Patricia Gibson.
Thank you, Madam Chair. We know the debate today is very important because in my own constituency, North Ayrshire and Arran, and in constituencies across the entire UK, some of our most vulnerable, those with long-term and quite debilitating health conditions, are relying on us to be their voice. If you speak to those who undergo work capability assessments, they will tell you that they find the entire process at best demeaning and at worst intimidating. It is a cause of deep distress, which is particularly alarming when one considers that some of the claimants live with challenging health and mental health conditions and find going through these assessments almost more than they can bear. These assessments indeed can exacerbate or even precipitate mental health problems. New research from the Universities of Liverpool and Oxford found that in areas where more people were assessed for ESA, there was a greater increase in mental health conditions and the prescriptions for antidepressants and even the number of suicides. And the research estimates that this may have led to 590 additional suicides. This is a robust piece of research and suggests a correlation between mental health problems and the rollout of work capability assessments, and the results of this research must be sobering for all of us. And as my honourable friend from Ayr, Carrick and Cumnock has pointed out, why are there such strict limits for the claimants when there is no time limit for the DWP to complete the mandatory reconsideration process? And it's already been touched upon. We know that an individual's condition may fluctuate, which means symptoms can rapidly decline and abate over the course of a week or a month, or even during a single day. What about folk with a condition like, say, Parkinson's? What if they're assessed on a good day? This means that the assessor is unable to accurately evaluate the impact of a person's condition on their functional ability. Work capability assessments also focus on a person's typical day, and this means that a person's best and worst days are averaged out, which can create a totally misleading impression of a person's condition. A snapshot of a person's health is not a true and accurate view of the profound and often very difficult challenges that they face. And what of progressive conditions? Work capability assessments don't take account of whether a condition is progressive, and this is a significant oversight and leads to systematically incorrect assessment decisions for people with Parkinson's. I will indeed.
Steve McCabe.
I'm extremely grateful to the Honourable Lady. She talks about the problem of people with progressive conditions and the delays sometimes with mandatory reconsiderations. Can she think of any logical reason why the government are refusing to give statistics on the outcomes of mandatory reconsiderations? Is there any obvious explanation for why that information is being withheld?
I thank my honourable friend for that point, and I'm afraid that the only reason I can possibly consider that this information is not forthcoming is that it does not present the work capability assessments in a flattering light. And I shall leave others to draw their own conclusions about how bad that might be. What is worse, the worst thing about this system is that those caught up in it, in this controversy and confusion, are those with long-term health conditions and some of the most vulnerable people in our communities. And as an urgent review of the work capability assessment is needed, I think there's a lot of consensus in the room about that. And as the Honourable Member for Sheffield Heeley pointed out, the cost of these assessments is increasing, with the sum of £595 million expected to be paid for 3.4 million assessments, around £190 per assessment. And there's also been a real problem recruiting enough medical professionals to meet the demands of these assessments, and we know that at least £76 million of taxpayers' money has been wasted by the failure to get a new IT system up and running, more than 2 years after it was supposed to be in place. And as has already been mentioned, the National Audit Office report released only last month revealed, quote, recent performance shows the DWP has not tackled and may even have exacerbated some of these problems when setting up recent contracts. I will
Neil Coyle.
The
The points around the rising costs and the backlog have been well made. Perhaps we could aid the Minister and ask her to consider removing some of the routine retests for those who have progressive conditions and conditions that won't change. We've all had the briefings from the excellent briefings from Parkinson's and MenCat, for example. Perhaps the Minister should look again at how frequently some people are being tested in order to save the taxpayer money and to save some of the stress and anxiety that the Honourable Lady has mentioned.
Patricia Gibson.
I think that's an excellent point, well made, and I thank my honourable friend for raising it. There's also a problem with transparency regarding these assessments. Only in December, the Working Pensions Committee report concluded that it was unable to fully scrutinise benefit delays because of lack of available data. The report said that if the DWP has this data, they should publish it, and if they don't, then they're making policy decisions in the dark, and the department should address the lack of data immediately. Chillingly, the DWP has admitted in answer to parliamentary questions concerning these assessments, concerning work capability assessment tests and connections with incidences of suicide or mental health problems of disability claimants, that it neither holds such information nor has any plans, and I think this is very significant, nor has any plans to collect such information. There's also been an admission that it doesn't have the information on how much, on average, it costs the department to fund an appeal against a fit-for-work decision. What is clear today, and what is becoming increasingly clear to claimants, is that this system is in a mess. There is a clear capacity shortage, wildly optimistic targets, a lack of transparency, problems with hiring and training staff. All of this in the context of dealing with individuals with long-term and very serious health problems who are simply trying to access support they need to survive. The National Audit Office has concluded that this system has significant financial and human costs. The current situation is cruel, inhumane, demeaning, and has been pointed out today repeatedly, not fit for purpose. And I genuinely and sincerely hope the Minister today will respond to this debate in a positive way and consider the significant financial and human costs to those who need our support and compassion, rather instead than being offered bureaucracy and judgment. This debate today is about so much more than simple work capability assessments. It's ultimately about the kind of society we want to create and the kind of society we aspire to be.
Natalie McGarry.